Hello friends, today we'll be learning about tongue. So, tongue has two surfaces. Dorsal surface is the rough surface and ventral surface is attached at the lower region, or it is the back side of the tongue. Now, we have sulcus terminalis. So, here is the foramen cecum. This foramen cecum is developed from the second pharyngeal pouch. So, development. It is developed from the second pharyngeal pouch and it is the remnant of the thyroid diverticulum. So, it is the remnant of the thyroid diverticulum and it is developed from the second pharyngeal pouch. Now, anterior 2/3 and posterior 1/3 part is the division of the tongue. So, what exactly divides it? So, we have sulcus terminalis over here. So, this line is the sulcus terminalis that divides the tongue into anterior 2/3 and posterior 1/3 part. Now we have different papilla that are present. So over here we have the circumvallate papilla in the upper regions. Then we have the filiform papilla and the fungal papilla. So towards the tip of the tongue we have the fungal papilla. So somewhere over here we have the fungal papilla and towards the side or the lateral regions we have the filiform papilla also in the center. So here we have the filiform papilla. Now this tongue has complete structure as here we have palatine tonsil. So this one is the palatine tonsil and we have foliate papilla somewhere over here. So here is the foliate papilla, circumvallate, filiform and then fungal. Now we will know about some of the structures present. So again we will draw the same figure. This one is the tip of the tongue and this one was the palatine tonsil and here we have the vallicula. So this one is this depression which is present is known as the vallicula. This is the vallicula. Now this one is the median glossoepiglottic fold. This one is the median glossoepiglottic fold and this one is the lateral glossoepiglottic fold. Now, why it is known as the glossoepiglottic? So, glosso refers to tongue and epiglottis refers to that structure epiglottis. So, the connection between tongue and the epiglottis is glossoepiglottis. Now, coming to the if we draw tip of tongue towards upward region. So this is the tip of the tongue. Now we have here frenulum. Frenulum. Then this one is the lingual vein, and laterally we have the plica fimbriata. So vein, it has the blood in it, right? So fiber is in the outer region, and vein is secured in the inside. So it can be simply remembered as fiber is outwards, this one fiber is outwards, and then veins are inside. Now we'll come to the muscles, intrinsic muscles. So if this were the tongue, then this is the superior longitudinal muscle and inferior longitudinal muscle. So this is the superior in the intrinsic muscles, superior longitudinal and inferior longitudinal muscles. So these both muscles have the function of shortening the tongue. So they are responsible to make the tongue short. The only difference is that superior longitudinal muscle makes the tongue concave, whereas inferior longitudinal makes them convex. Now coming to the vertical and the transverse muscles. So vertical muscles help to make the tongue broad. So how are the vertical and transverse muscles? So this is the vertical muscle. So this is the vertical muscle, and this is the transverse muscle. So their function is vertical muscles help to make the tongue broad, whereas transverse muscle help to elongate the tongue. Now by making the tongue narrow. If the tip were in the upward region, then this is the sublingual duct, and this is the submandibular orifice, submandibular orifice, also known as sublingual papillae. Now other muscles that are the extrinsic muscles. So extrinsic muscles include the palatoglossus muscle. So if these are the lips and this is the tongue, then palatoglossus muscle is like this. So origin is of the, this is the palatoglossus muscle, this is the tongue. Then origin is, it originates from the palatine aponeurosis. It inserts into the palatoglossus. It inserts into the palatoglossus arch, and its function or action is the roof of the tongue backwards. So it pulls the roof of the tongue backwards so that it closes the oropharyngeal isthmus. It pulls the roof of the tongue backwards so that it closes the oropharyngeal isthmus. Now coming to other muscle, that is the hyoglossus muscle. So hyoglossus muscle, it originates from the greater cornu of the hyoid bone. So if this was the mouth, then this is the tongue, then hyoglossus muscle over here. Now this is the hyoglossus muscle. It originates from the greater cornu of the hyoid bone. It inserts into between sternoglossus and inferior longitudinal sternoglossus and inferior longitudinal muscles. So between the styloglossus and inferior longitudinal muscle. Now its action is, again it helps to pull down the tongue. Now that is, it retracts the protruded tongue. Now coming to the styloglossus muscle. So if this was the mouth and this was the tongue, then from the skull, styloid process, muscles originating are, this is the styloglossus muscle. Now it originates from the styloid process of the skull. Yes, styloid process of skull. Now its insertion is the side of the tongue, and its action is, it pulls the tongue upwards and backwards. So this backwards is frequently repeated, right? Now we have the genioglossus muscle. It is also known as the life-saving muscle, because if the tongue were not to hold in the same position, it could fall in the throat and cause death. So this genioglossus muscle helps to hold the tongue in the original position. So this is the genioglossus muscle. It originates from the genioglossus process of the mandible or genial tubercle. So it originates from the genial tubercle of the mandible. It inserts into three different areas: upper, middle and lower. Upper, tip of the tongue. So it originated from the genial tubercle of the mandible and it inserted into the upper tip of the tongue. Then there comes the dorsum of the tongue, and finally we have tongue, right? Posterior region, that is hyoid bone. Now coming to the arterial supply, we have the formula PCL nursing, right? PCL. So P refers to pharyngeal, C refers to external carotid, and L refers to laryngeal. So arterial supply means PCL. C refers to external carotid. This external carotid give rise to pharyngeal and laryngeal arches. So this is the pharyngeal and the laryngeal arches. Also we have the facial artery that gives rise to the tonsillar artery. This was the arterial supply. Now venous supply, we have the lingual vein that gives rise to the internal jugular artery. So we have venous supply or venous drainage as lingual vein that gives rise to the what? Inferior jugular artery. Now coming to the lymphatic drainage. For the lymphatic drainage, we can simply draw the figure. So anything which is present up is generally referred to as cervical. So these are the cervical lymph nodes and present towards the tip of the tongue or towards the mandibular region, we have the submental nodes. Then we have the jugulo-omohyoid node over here. So this is the jugulo-omohyoid nodes. And here we have the submandibular nodes. Now coming to the nerve supply. So nerve supply we can understand by a tabular data that shows anterior and posterior most regions. So nerve supply developed. Now anterior 1/3 or the lingual. So this one is the anterior 1/3 or the lingual part. Then we have posterior 1/3 or the glossopharyngeal and posterior most 1/3, that is part of the vallicula. Posterior most part of the vallicula. Now development of epithelium from endoderm. So they develop from the first arch, they develop from the third arch, and they develop from the fourth arch. From the tubercular impar, from first arch from the tubercular impar, which soon disappears. Now this is from the ventral part of hypobrachial eminence. Now from the all dorsal part of hypobrachial eminence. So simply what we can understand is that this anterior 1/3 part, that is lingual part, is supplied by the lingual nerve, but it is developed from the first arch of the tubercular impar, which should disappear, and posterior 1/3 is supplied by the glossopharyngeal nerve. Third arch which forms or which makes the ventral part of the hypobrachial eminence, and posterior most part of the vallicula, that develops from the fourth arch from the dorsal part of the hypobrachial eminence. Now this was about the tongue. Thank you.